Hello, this is David Bishai, and I'm lecturing today on primary healthcare and the Sustainable Development Goals. There are 4 parts to this lecture, and they'll be divided into 2 short videos. In the first video, we'll cover Sustainable Development Goals and selected SDG indicators for Hong Kong. And then in the second video, we'll cover this process called collective impact and illustrate it with Hong Kong United for Heat Health Emergencies. And that'll help us illustrate the ways that primary healthcare will help address the SDGs. So let's move on and briefly talk about the Sustainable Development Goals. There are 17 SDGs, and when we number them and show little graphics of them, it helps motivate a vertical approach where we assign each of the SDGs to an agency or a group of agencies and make them accountable for delivering action and progress. In a more horizontal approach, one can integrate the spillovers and connections between the multiple different SDGs. Top-down management of SDG realization is effective. One can just state an objective of what one wants to do. The assigned government agency can work out how to achieve progress. They can make a budget, and they can monitor their progress. There's advantages to dividing and conquering the SDGs. The indicators can force accountability, and one can have welfare agencies work on poverty, food agencies working on hunger, health departments and doctors on health, civil engineers on sanitation, educators can work on education. However, there are disadvantages. Government sectors often don't know how to work together very well, and there are cross-cutting issues that get lost. Gender equality lives in SDG number 5, but if one wants to achieve gender equality, one has to work on poverty here in number 1, on health in number 3, quality education in number 4. Gender equity requires decent work in number 8. Gender equity requires reduced inequalities across multiple divisions in society. And of course, gender equity requires peace and justice and strong institutions to guarantee promises to women. Energy is also extremely cross-sectoral. So decent work and economic growth will have impacts on what we can do with energy, as well as industry, innovation, and infrastructure planning. Number 11, sustainable cities and communities depends on what we do with our energy. Number 12, responsible consumption will definitely affect affordable and clean energy. Economic growth is this last one, just showing how cross-cutting the SDGs are. Our policies on how to grow the economy benefit from our policies to improve health, and our policies to improve education cross spillover into economic growth. The same with gender, getting women involved in the labor force. The same with all inequalities. So policies for economic growth cross-cut. One can take it too far and say everything is connected to everything, but better to be strategic and see what falls together and find ways for governments to work together. When they join forces, different government agencies can complement each other. Their multiple perspectives can make things better. They can multiply resources by relying on volunteer groups and civil society, and it helps improve trust and inclusion to have all of society involved in planning. However, the difficulty is a workforce in governments and across society that specializes. We have workers that are not trained to collaborate across sectors. And experts, because they're experts, spend all of their lives and careers inside their silo, inside their area, and they don't have incentives for collaboration. So intersectoral collaboration faces barriers. Lack of trust is a barrier. There are rigid rules and bureaucracies, and a bureaucracy focuses on compliance and ticking off boxes. Success for a bureaucrat is that they complied with all of the rules. They don't get praised or rewarded when they show an initiative to develop a new mission. The other problem with bureaucracies is that they feel that they're competing with each other for a fixed budget. More money for one agency is less money for another. And so cooperating might offer extra budgets for someone that's not in your own group. They also see the world through different lenses. The paradigm of the biomedical world is everything is a disease and you need to fix it with a medicine, versus in social welfare agencies, root causes might be in culture and language and schooling, and these other paradigms don't mesh well together. There are opportunities when we collaborate, the opportunity to outsource the mission and the big thinking to agencies and contractors. The contractors can be one form of keeping the compliance with the government who ticks off boxes, but let the contractors do the work of collaboration and convening. Paradigms don't align. I love this cartoon where we're having intersectoral collaboration with multiple different lenses. They're saying without a bedrock of X, it is impossible to imagine any sort of stable or meaningful society. Question, what is X? And the lawyer says it's a legal system, the librarian says it's information, the military says it's security, and so on. I love the aid worker. Whatever the donor wants X to be is what the most fundamental thing in society is. The paradigms don't align, and they have trouble communicating. Section 2 is about how we apply this SDG concept in Hong Kong. What are some of the indicators? We won't go through all of the SDGs, but a couple one. Let's start with SDG number 1, poverty. And this is a map of poverty by district in Hong Kong. We have our most high poverty district is here at the bottom, Kwun Tung. And if nothing were done to alleviate poverty, we just had people's paychecks, in Kwun Tung we would see a poverty rate of about 27%. In Hong Kong right now, the poverty rate, the poverty cutoff line for a family of 4 is $20,800. That's up from where it used to be about 10 years ago. It was $14,800. So even with a poverty line of $20,800, 27% of the people in Kwun Tung would have been poor had nothing been done. The most richest part of Hong Kong without any subsidies would have been Wan Chai, where just about 14% of households would be below the poverty threshold. So that's the light green. However, Hong Kong has a lot of anti-poverty programs. And these anti-poverty programs bring down the post-intervention incomes. Poverty rate would only comes to about 17% in Kwun Tung after all of the benefits are figured in. So we're seeing on average about a 7 to 10% reduction in poverty because of these anti-poverty measures. At the left side of the slide, I just want to review there are 3 types of anti-poverty programs in Hong Kong. There are recurrent cash policies, where every month people who meet a means-tested threshold on their own income are eligible to receive cash from the Hong Kong government. People who are elderly and don't have enough money can get cash. Working families get cash, and there are education benefits for students, families trying to put their kids through school. There are every now and then recurrent cash policies. These are sometimes motivated by economic events like a pandemic. There will be an anti-epidemic fund doing these one at a time cash payouts. And then finally at the bottom there are means-tested in-kind benefits, and the largest one of these is subsidized public housing. As also offering free kindergartens and daycare centers for the poor. So poverty in Hong Kong is being combated not just with one agency, but many different agencies are involved, and we have to fight poverty using housing as well as schooling, as well as social service agencies. I thought with this slide we see that there is a geography of poverty, and one can walk around Hong Kong and see gaps between our most poor areas in Kwun Tung and Tuen Mun and our least poor areas in southern as well as in Sai Kung and Wan Chai. Moving on to the child poverty trends. what has happened in Hong Kong is that, yes, there's progress because of the anti-poverty measures, and yes, we've brought the poverty rate would have been up at 25% in 2019, and with the anti-poverty measures, bringing that poverty rate down to about 17%. But over time, there's been very slow progress in bringing down the child poverty rate over time. It's really stuck here in the high teens at about 17%. SDG 4 is where we go over schooling history, and the schooling history, I mean, is the schooling of our seniors. When they were children here in Hong Kong 60 and 70 years ago, there were very low rates of schooling for men and women. And we see large numbers of our 85-year-olds, especially these 85-year-old women, where 60% of 85-year-old women had gone to no schooling, and 25% of our 85-year-old men had no schooling. Schooling was phased in. It did not become mandatory until about the 1980s during the British colonization of Hong Kong. So we have large numbers of seniors, even our youngest seniors, 65 and 69, have only had primary schooling by and large. And you're seeing them hovering here at about 40% with just primary schooling, and it's worse for older women. We have this generation that did not go to school, and that inhibits our ability to address their needs. And the same as there is a poverty gradient, there's also a schooling by income gradient, and we see that post-secondary schooling is highest at 70% among the 10% of the richest households in Hong Kong. But of the poorest households in Hong Kong, the number who've gone to post-secondary schooling is only about 18%. In terms of secondary schooling right now, we're seeing pretty stable rates across income deciles, where we're getting more than 50% of our households having achieved secondary schooling at age 15 or above. But what's still true is that the blessing of post-secondary schooling is being concentrated more so in the highest income households in Hong Kong. Here's the income distribution with monthly income. Remember that in Hong Kong, for a family of 4, the poverty cutoff is right about here at 20,000. So this is saying that more than half of the population needs 2 incomes in a household of 4 in order to get above the poverty line. And we see that this massive amount of the modal and the median income in Hong Kong for a single individual is not above the poverty line. So we are committed to earner families in Hong Kong based on this income distribution. This tail obviously keeps going. There will be people spanning out towards much, much higher incomes at the far right tail. Here is what is similar to a Lorenz curve in Hong Kong, where we line up the number of population. This is 10% of the population in the first, second, third, fourth, and by here we've gotten to 100% of the population. And we see that the 10th decile of population has been growing faster. If you can watch the gap between the dark green and the light green, the 5-year span between 2006 and 2011 moved their incomes up by 20,000, and another 5-year span moved their incomes up by another 20,000. So the growth in income is being captured much more by the top decile. And down at the bottom, each 5-year period of economic growth in Hong Kong has invisible movement of the incomes of the first decile and very, very small changes in the incomes of people below even the 6th or 7th decile. So we capture the benefits of growth in the top, tiny little bit of trickle down in the way Hong Kong has grown its economy. Here we see how income distribution goes across schooling rates, where the median monthly income for people with high degrees is about $27,000 in 2016. And again, you see the capture of the benefits of economic growth being concentrated in the people that have had a degree course. They had a lot of benefit between 2006 and 2011, and some benefit between 2011 and 2016. There's been some growth in incomes at other levels in the economy. We're seeing a little bit of improvement for people with a primary school, and there was a pretty good increase for those with no primary school. So there is some concentration of the benefits of growth to schooling. But in 2016, these gray bars seem to move dramatically across the income distributions. Let's move on to SDG 11, where we look at housing. And in the gray bar, we see the people who've been able to get private permanent housing. And in the highest decile, we see that 90% of people are living in private permanent housing. That falls down to about 30% in the second decile and 42% in the first decile. So this goal of getting private permanent housing is concentrated among the higher income groups, but you'll see even down at the bottom of the income distribution, there's 30 to 40% living in private housing. In terms of public rental housing, that also seems to span up above the middle of the curve. We see a lot of people in the first, second, and third decile in these dark green bars getting public rental housing. And public rental housing also benefits people up above the median. So there's some spillover of benefits across the income distribution. Well, that covers it for now, and I'll be back in part 2 where we go over collective impact.